focus of our care home Vanguard really is improving the care and the life experience of some of the most vulnerable people in our community.
We have some very good care homes in Wakefield, and we have some care homes that just needed a bit of extra support, and we wanted to feel that if it was your mum or dad that was going to be going into that home, I would want them to go into that home. I would feel happy that they were in a home in Wakefield.
And so when the Vanguard came along, it was an opportunity for us to pitch, to try to put a group of things together that would actually make their lives better.
We worked really closely with Sutton. They've got the hospital transfer pathway, which is also known as the red bag, that they developed. We adopted that in Wakefield, and that is basically a red bag with hospital information, transfer information in there that goes from the care home in the ambulance with the resident to the hospital, and then back out again when that person is discharged.
We needed to understand more about the individual. We had a gentleman with severe dementia who was in one of the homes. The homes couldn't cope with his behaviour. He was up a lot in the night and became quite difficult to manage. What was clear after a portrait of a life and discussions with his family was that he'd worked as a miner all his life, and that his normal behaviour was to get up at 4 o'clock. And once the homes understood that and left him his breakfast, it felt like he was behaving how he's always spent his life, getting up, having his breakfast, and then he went back to bed. And it didn't require more medication, it didn't require more night sedation, it required an understanding of of his lifestyle.
The impact that the Portrait of a Life has on the staff in the care homes is massive. The fact that they are finding out things about individuals, residents that they care for, that they never knew about.
The stories in people's lives can be as enriching for those that hear them as it can be for those that tell them.
The Multidisciplinary Team, or MDT, is one of the elements within the care home Vanguard. We're made up of varying practitioners, including general nurses, mental health nurses, physiotherapists, OT, support workers and admin.
The MDT have a meeting on a Monday, and if there are particular problems with somebody has been referred to them, then they will look at the whole patient record. They will have access to the medical record, but they'll also have access to any work that's been done by the Portrait of a Life team, by the registered managers, and so they can look at the whole picture of why that particular resident needs their support.
I personally can honestly say I've worked in a holistic way with a true multidisciplinary team.
People have been absolutely really keen to join the Vanguard, and I think that not just the care homes, the staff that work at the care homes have found it amazing. We work with care homes from big corporate ones to family-run care homes, and it's been really really great that they all want to get on board.
If people are part of a community and feel part of something and have social contact, you get better health and wellbeing outcomes.
This has been a great journey because we knew we had a question to answer, a problem to solve, something that needed to be done differently, and the Vanguard has given that opportunity to have some focus, some funds and some people time to make a real difference. I think one of the joyous bits of the Vanguard has been that it's not been all clinical. It's been about understanding how people are and what people need, and that's been a real joy to actually realise that we should have, all the way along, should have been treating residents in care homes as individuals, as people living in their actual home, and that's, I think, something that will stay with us and has made us think differently, and that change will be enduring.